exposure. In our Avera Medical Minute tonight, if you suffer from chronic sinusitis, sinus infections, and haven't found relief through medicine, there is a relatively new technique that may be able to help you out.
It's a minimally invasive approach in treating your chronic symptoms without surgery. I talked to Dr. Craig Hedges from Midwest Ear, Nose, and Throat right after he got out of surgery and asked him about balloon sinuplasty.
Balloon sinuplasty is a new technique where we insert a flexible tube or catheter into a sinus, and it has a balloon attached to it that by inflating the balloon it can dilate the drainage pathways from the sinuses.
Why is this a good option versus what you used to do?
The concept of surgery over the years has been to be as little invasive as possible. With the balloon sinuplasty, we actually aren't removing any tissue at all, but merely pushing things out of the way. When you remove tissue, it increases the likelihood of scar tissue forming, which can often cause a reobstruction of the sinus drainage pathways.
And this is probably less invasive because you go up through the nose?
Right. Less invasive, less trauma to the tissues, less recovery time, less bleeding.
What's the outcome been?
The outcomes have shown to be very helpful, very good. It's not something that can be used for every sinus operation or in every patient, but it's probably most helpful for opening the frontal sinuses or forehead sinuses that are very narrow and difficult to open without risk of causing scarring that can cause re-obstruction of the drainage pathway.
All right. Thank you, Dr. Hedges. For more information on this, call 877-AT-AVERA or visit our web channel at ksfy.com. Tonight on KSFY Live at 10, Dr. Hedges lets us watch as he performs a balloon sinuplasty on 8-year-old Jordan Osbeck from Brookings. Her mom, Missy, tells us why this procedure was really a last option for them and why Jordan has been so sick her little life.
Aw, hopefully it helps her out.
I'll tell you at 10.
There's the tease. Coming up on World News at 5:30.